So what we started by doing, this model, these white mice are 4T1 breast cancer. That's a triple negative breast cancer. It's a very challenging tumor to treat. As you know, it has many of you will know it has a very terrible outcome. And one of the kind of horizons for this disease is immunotherapy. So what we've done is we've taken this model. This is a well-respected preclinical model, and we've taken the 4T1 tumors in the mice, and we've grown two tumors, one on the left side, one on the right side. We're treating one side, and we're watching both the effect of the treatment on that side and the effect of the treatment on the other side. If there's an effect on the other side, of course, the implication or the assumption is that that effect is generated from a systemic response. What we did on one side created there. What you're seeing on the bottom, these two plates are essentially, this is what the tumor size under the skin of the mouse on the left side, and that is effectively what's left over after the tumor has been impregnated with gold nanorods, and then the gold nanorods excited with near-infrared light. And so there's always a residual mass, and the residual mass is essentially structure, scaffolding the tumor cells need to live on, but it's residue. There's no viable tumor in that piece. And so when you see the effect of this, on the right, what you're looking at is essentially, this is gold nanorod impregnated tumors, and the tumor volume. This is at ground zero, essentially just under 200, 150 to 200. And on the untreated side, you see tumor growth scaling up the graft, up and to the right. And with one single treatment with the laser, you see almost immediate. It's quite shocking and remarkable how quickly this biological effect is. And you'll see tumor shrinkage. And as David indicated, we were quite surprised to see this effect so quickly and so reliably. And we've produced this over and over again. What have we done? That was a 4T1 model. What you're looking here is at a melanoma model. So melanoma is the disease that we're going to challenge first. The question we asked after that is, so if we've got such a great response, one treatment essentially arrests tumor growth. If you allow that, nothing's 100%, of course, and so some tumors will start to regrow. And so if you retreat that tumor just near infrared light and gold nanoparticles, not reimpregnating with the residual gold nanorods that are in the tumor, if you retreat a second time, the question we asked is what would happen? And we were pleasantly surprised to see that would effectively annihilate the residual tumor that might grow. And so, this is so reassuring. This is nothing but essentially a second dose of near infrared light to activate the gold nanoparticles to generate an immune response. And what I'm going to suggest to you from this, if you look at the slide, is that is a second event. So what I'm going to show you is that the likelihood, and we're proving this in our ongoing research, is that we've generated not one but two, in fact, two immune responses in one tumor. This is knowing that there are multiple antigens in a tumor, multiple triggers of immunity. The second activation very likely generates brand new immunity a second time.